Okay. Hi, everyone. It's MissNikkiAnn. Okay. I thought I'd make a video, obviously, because this is what that is. I'm waiting at a doctor appointment for my son. So, the dentist. It's the one appointment that I don't go to because I get tired. You guys know that. So as far as let's go with dysautonomia. Things are the same except that my believe it or not, my psychiatrist is trying out a medication that works on so many different levels that fit within the parameters of the issues that dysautonomics have, from POTS to gastroparesis, so forth and so on. And so she's tried the med in three separate dosages. Um, and yeah. And the highest, the middle, and now we're down to the lowest. And the lowest is actually doing more than the highest and the middle. And so it how to put it's helping things that I never thought would fall within that category. So it's helping my gastric system. It's helping my POTS. It's helping my urinal system. People, it's helping so many things, and I've been able to get rid of multiple medications. Multiple. And it's great with dealing with mast cell activation disorder. So it's doing a great job as far as the histamines. I've been able to get rid of that. I mean, people, it has gotten rid of so many symptoms that required separate medications. Now, I has it been a few months now? And we started because I was having sleep issues. So it started there, and just the research, people, but my psychiatrist is lucky because she knew me when I didn't have, a diagnosis of dysautonomia, when I wasn't even going to her for that. Okay. Totally something that seemed unrelated when indeed, yes, I was molested as a child, but then there are some other factors that really magnify the anxiety that comes with it, and the chemical reactions and all of this. So they are all interconnected. My pain is different. The issue that we're having is, oh, and how about this? It works kind of immediately, and it stays in your system for 23 hours, I think it is. So I went from having to crawl into the house to the next day being able to stand up and walk into the house as far as the steps. And there was only two steps that I was talking about here. So immediate change. But I am having some allergic reactions to it. When I say, I mean severe. My skin is like I have paper cuts everywhere, like with the mast cell activation disorder, welts and cuts, and it's like you're pouring alcohol over them. Um, where, but it's working so well that it is well worth our. It's been my decision that I don't mind the symptoms. Let's see what happens, if I continue at this lower dose. So I've decided that I don't mind dealing with that problem. I can take Benadryl IV push to help it, but not everybody has that, and taking two Benadryls by mouth is not the same, people. I hate to tell you. So, yeah. So, and I don't want to say too much because, you know, she's done a lot. She's been there from the beginning. She's the person who told me about Vanderbilt. And she's the person I would print out stuff about the connection between histamines and pain, histamines and psychiatric things. And so I don't know. And originally I already knew about this because my pot specialist, my first one at Boston University, was saying you need to have a psychiatrist on your team because that is also a component that is affected by dysautonomia. Lucky me, I was already seeing one, okay, and seeing a psychologist and going to women's group session and doing meditation with my psychologist. I was already doing a lot that had nothing to do with dysautonomia, and so we've been able to watch it a little bit differently based on how I started with her. So yeah, amazing if you're not allergic. And as we know, dysautonomics have a tendency to be very sensitive to medications. Um, I'll see. I'm not gonna say the name. I'm not gonna. I don't. It's just probably not a good thing. But the things I can mention, that have definitely changed my life, and it's been long enough for me to say now. It has been that IV push Benadryl, IV push Zofran, my 3 liters of D5 normal saline a week. Um, Trying to think. Oh, my implants, my Medtronics InterStim implants. Um, wow. Obviously, my port, my Paxil, and I've been on that since before. It's phenomenal. What do I still? As far as like inhalers and things, I don't know. How about we just stick with those things that I gave you? And without those things, my life, I wouldn't be able to just sit here and wait for my son and talk. Okay. But things do keep happening and progressing. And I just felt the severity of the burning from the side effect from this med is like an understatement. I have open wounds, people. Hmm. Open wounds. But being able to have a different quality of life as far as socially, so far I'm like, okay, I can take it. But it works, people, immediately on all of those issues. Immediately. You're not waiting for a month for, no, no. And I still take my Plaquenil, and I know the med list is long, but the fact that I got rid of 3 meds, yeah, yeah, got rid of 3 for that one, it's a big deal. And I think that one, going to see a psychiatrist and an allergist added to their team if the people are willing and open. And that's the problem, I think. I had these certain doctors beforehand because I'd gone blind in my left eye. Oh my God. So I already had a neuro ophthalmologist. See, these certain things I already had in my bag of tricks before I had dysautonomia or a diagnosis of the different forms of it. People. And so I'll just keep watching with the medication. And if you can find yourself a good psychiatrist and a patient allergist, you may be able to, and I think I would like to thank Dr. Diana, because oh my God, the Driscoll theory and all these things, it is because of her that I added an allergist to my team. And yeah, because of her. Without her, this journey, I wouldn't be where I'm at right now. I would probably just be bedridden and struggling. What the Zantac, Zyrtec, what I tell you, levocetirizine, and the Zantac, for even it's generic. I use both. It changed my life. Having multiple antihistamines. I'm going to rave about Benadryl because in its push form, okay, I gotta be clear. You can be having a dystonic episode of some sort if you have dystonia, I have symptoms like that. And You push through that 50 milligrams of IV push Benadryl, people, immediately things change. Um, and that's if you have, like, a lot of us, people just have POTS and whatever comes with that. But those who have multiple issues with the autonomic nervous system, Benadryl and other antihistamines. But I would give up the list of those and just take Benadryl every day. If someone's like, well, we can't do all this, this is just a scenario. I'm like, okay, get my Benadryl push, because even with the others, I still need the Benadryl push. That's how strong of a situation I have. Okay. And all of this doesn't control it completely. I still have to push that Benadryl through. And that Benadryl is needed for other issues. People, that's important. It's not just for one issue. Benadryl can do a lot. So yeah, I'll keep you posted. Um, there's so many million things I could say. No, things haven't gotten better, but my ability to cope have gotten better. Has gotten better, and that means a lot. And I got to this point by, how about this, Xing out lots of doctor appointments. I'm like, how am I ever going to feel better if I'm never home to feel better? And I mean, important specialists that other people would die to have. I spend my every day, but I do see them. I just have had to X out how often I see them. And I just try to do more for myself. And then I'll call and ask a question that can lead me and guide me to whatever. Because, yeah, I did speak with you guys after all of the surgeries and the lung issue and everything. So, yeah, still having the heart thing. Haven't seen the cardiologist because I'm tired. Okay? I'm tired, everybody. So, but those are my own preferences. We all have different preferences. We all have different levels of help. So, living with my mom and dad, totally different than having to do this as a mom. And also, um, having parents who say, it's your life. You run that show. You tell us what we need to do. Because I know other people are with maybe parents, but parents are not letting the patient say what is needed. Because not just health wise, but mental health, can make all the difference, people. That mental health not being in place will trigger so many other problems. Um, I'm going to stop now. I'm learning that less is more when it comes to explaining this stuff, because it is so complex. It is so complex, and the things that my psychiatrist has studied and found out, it's just complex, people, and it's a lifetime with human beings understanding health and environment and issues, and it's a lifetime. And I'm not looking for perfection. If a cure came, or if this pill continues to do what it does, great. But I can't bet on anything. You get what you get. All right. And that's it. I wish you all the best strength possible to make it through each day. And when you're not strong, I pray for the strength of others to help you to stand by the grace of God. Okay. Bye bye.